Good morning, everyone, and welcome back to the Solutions to Wellness podcast, the podcast that brings you local experts in the wellness industry. So today we're going to be taking a little different perspective on chiropractic care, and Zach, give us an introduction.
Excited today. We're sitting down with Dr. Mikhaila Weister. Welcome to the show, Dr. Mikhaila.
Thank you, guys. I appreciate it.
So, Dr. Mikhaila, tell us about kind of your background from school to where you're at now with 920 Wellness.
Sure. My story is a little bit different than most people's. I'm from Appleton. Originally, I went to Xavier High School, and then I went to UW Oshkosh. I had no idea what I wanted to study in my undergraduate degree. I was looking at social work. I was looking at psychology. I was looking at going on to med school. So I was kind of all over the board. So I chose psychology just because I think it fell into my lap, but I do really enjoy psychology, and it really actually helps me a lot with my day-to-day patients. I think I know more about my patients sometimes than their significant others. But so I went to UW Oshkosh for psychology, and I got to my last year, and my parents were like, well, what are you going to do with that degree? You know, you kind of have to go on and either your master's or a doctorate program. It's one of those degrees that, like, what's your next step, right? And I shadowed a family friend who owns her own business here in Appleton as well, and I just absolutely fell in love with the whole philosophy of chiropractic. I mean, it's more even of a lifestyle for me than I would even say a career, and there was no turning back at that point. So I graduated in May of 2013 at UW Oshkosh, and then I started in July at Palmer. So I had about 2 months off in between my undergraduate studies and went down to Palmer, which is in Davenport, Iowa. And then I graduated from there in 2016. And then I wanted to come back home and started working at another chiropractic office here in Appleton. And I think I just always had it on my heart. And as an entrepreneur, you know, you always want to start your own business. So I was pregnant with my peanut, and I was taking my licensure and boards. So I was a single mama at the time, and I decided to start my own business. And it was kind of a whirlwind of having a 4-month-old, not knowing where finances were coming, but just having it on my heart to open up a business. And it's been quite a year of amazing blessings and busy business struggles and all the things of ups and downs. So, yeah.
I'd like to backtrack a little bit about when you graduated with your bachelor's degree and you were kind of in, what was that looking like as far as your next steps there? Because I think a lot of us might go to school or might have a job transition. We're not exactly sure. So how did you really dive into, was it just reaching out to people? And you mentioned job shadowing. What were your steps there?
Yeah, my mom is really an intricate part of that because she comes from a nurse practitioner background. So I was kind of learning more of the medical route from her, and she was setting me up with some of her doctorate friends, and that was just something felt off for me personally. I knew in my heart that I had some things to wrestle with from the medical community of the philosophy behind it, and so I just knew that personally wasn't a good fit for me. And then my aunt is a social worker, so I kind of went down all these different avenues of testing the waters out, and I wanted to see what was a good fit for me. So yeah, the integral part really was job shadowing and checking into different routes and different avenues of what would be a good fit for me. So when I shadowed my chiropractic friend, I mean, everything about it and the philosophy behind the career and the lifestyle choices just really hit home for me. So it was an amazing discovery, and I'm so thankful for it because chiropractic was not a part of my life growing up, and neither was it for my family. So it's been a really interesting paradigm for my own family to switch into more of the holistic things from the teachings I brought back from Palmer. So it's been cool to help educate my family on that, and they've respectively also integrated in their life too. So that's been neat.
I'm curious, do you and your mom have like conflicting ideas on health? And you can share as much as you want on this, but I'm just curious, her coming from, you know, the traditional medicine side and you being in the holistic medicine side, what's the relationship like there?
Yeah, great question. I used to say it was conflicting, but I think now dinner conversations are a little bit more educational. You know what I mean? There is a time and a place for every niche of medicine. You know what I mean? I like to tell my family and my friends that we're more of that preventative care. You know, we want to teach you the right steps to fight disease, to prevent disease. But obviously, if you get in a car accident or you break your arm or, you know, you need a life-saving emergency type case, that's, I really believe, where that traditional medicine should step in versus that preventative day-to-day. I really hope that the paradigm starts shifting, that chiropractic care can be seen as your primary care provider. We are trained to be that in school, so I really hope the shift starts seeing chiropractors as their primary care provider instead of going towards the traditional medical route for preventative care or day-to-day stuff. So I think that'll really help our society fight disease and all the things like that. So constructive conversation, I like to call it, right?
Definitely. Is there a specific instance or experience in your life that really got you passionate about more holistic, or was it constant research and sort of development on those benefits?
I think starting out, it was definitely that constant research. When it really switched was when I had Lucy, my daughter, because then you're starting to make medical decisions for someone else. And so not only for myself am I trying to be holistic and natural to take care of my own body, but then I'm now taking steps to really put Lucy's health at the forefront and making sure that I'm being the best mom that I can be and making sure that those medical decisions are setting her up for success in the future. So I think that's when the shift was for sure, when I had her and all the things that go along with parenting, and the traditional medicine route versus the more holistic route was definitely an interesting switch for us too. So, yeah.
You had some pretty big decisions to make when you started your business at the point of your life. Can you talk a little bit about how you decided to, and why you decided to start your business at that certain point in your life?
Oh, gosh. I think my family would look back and just think I'm absolutely crazy. I mean, I'm a single mom, 4-month-old baby. Like, why not just go get a job that you know you can clock in and out and you're going to for sure get a paycheck? But, faith is really important to my life, and I do feel like God really connected on my heart to start this business, and I knew that was really important to me one day. So it just all aligned up that I found the space that I needed. I found the right practitioners that needed to line up. Financially, it was astronomically really low to have an overhead and stuff. So I didn't even need a business plan with a bank and all the things that, would have made this a little bit more challenging as a single income earner. So there was just a lot of things that aligned in my life at that time that definitely made it right. So I'm very thankful for the connections in the community, and then the practitioners at that time that I found was a huge help too. So,
I mean, I think it's important for people to know that it didn't just kind of happen, right? You're just extremely actionable and seeking all these opportunities.
Yeah, absolutely. I feel as though I was very proactive about it. I had to, always put it out on social media, or I had to go to these networking events. These people didn't just come knocking at my house. I had to go out and actively seek them too. But I do believe that there is circumstances that also led me to meeting them too. So it's been pretty neat to connect with them, and it was trial and error. There was some practitioners that said they would love to join, but I just knew it wasn't a right fit on kind of ethical, moral reasons, but then also just the type of practices that they were experiencing or having at their office too. I just knew that wasn't going to be a good fit for 920. So it's, that interviewing process of who is going to collaborate and who is going to be with us for long-term goals. And we don't want that revolving door at 920. We want people to be here, feel comfortable, feel safe, and then also, grow with us as a brand too. So we wanted to find the right fit as well.
I'd like to hear a little bit more about chiropractic care. You talked about, having, your services be a primary care provider. Who is this for, and what does the practice look like? Is it, weekly, monthly? How does it help? Kind of dive into that.
Sure. Yeah, there's a couple layers to that. So when I'm referring to primary care provider, I always tell people when we were going through school at Palmer, we were taught how to do prostate exams and pap smears and all the things of different whole body care. So a lot of people would look at us like, why would my chiropractor be checking my prostate, right? Like that's kind of weird, but I don't do that in my practice. But I'm just saying that is the mentality as chiropractors, that we're hoping the general population can see us as their primary care providers. You know, I have a lot of moms who bring in their children, and I do examine their eyes, ears, nose, and throat. I do their school checkups for their forms, and they bring those back to the school. So a lot of people are now learning that chiropractors are trained, and it is in our scope of practice that we can do that. It just kind of depends on the chiropractor if they feel comfortable or what they want to align themselves with. But it is nice to know that you don't have to go to a medical office. You can come to your chiropractor, and that is, in, like I said, our scope of practice to do more of the health history forms and more than just cracking your back and migraines and low back pain. There's a lot more to it. In reference to how often do my patients come, it really depends. You know, if I have a person who has a herniated disc in their back versus someone who's on a wellness care, I really like to tell my patients, if they're on the wellness route, it'd be great to see you, you know, at least once a month. Some people can do it every other month. It kind of depends on, I really trust the patient, and they kind of know, oh, I'm getting stiff, I'm feeling achy, those types of things. So if they're on that wellness plan, it's usually once a month I like to see them. I kind of refer it to as their tune-up or their oil change. You know, you go to get your car fixed every 3,000 to 5,000 miles, well, you got to come get your body checked out, and the same reference there. So it really depends. I have some babies that I see every week because they're really struggling with latching and breastfeeding, or they're struggling with reflux or constipation issues. So there's more of the visceral organs that we're trying to alter their function versus just looking at the low back pain or the headaches and migraines that chiropractic care is usually known for. So it really just depends on what the patient's previous treatment is, what their health history looks like.
So you can use chiropractic care on a baby to help with constipation, with latching for breastfeeding. How does that work? I'm curious.
Yeah, crazy correlation, right? So let's dive into the constipation piece. So if you're looking at a spine, there's individual vertebrae that are stacked on top of each other that makes up your spinal column, right? Running along the back side of your spinal column is where your spinal cord is housed. So your vertebrae are strong structures, and that is good for protection of that spinal cord. Your spinal cord is probably about the size of a quarter, a little bit bigger in adults, that is running down the back side. And that's kind of your nervous system highway. Your brain is sending communication down the back of your spinal cord. From the spinal cord, then you have adjacent nerves that are coming out, and that's all at different levels of your spinal column. So, you know, up in your neck area or your cervical region, that's going to be certain nerves telling my muscles of my face to smile or frown. It's telling my thyroid to produce certain hormones. So you can kind of picture that all the way down. From the vertebrae that are having the nerves coming out in front of it, you know, I have my heart and lungs that I have nerves telling my heart to beat, my lungs to breathe. As you go down in the lower vertebrae, or your low back, that's called your lumbar meaning low back, right? So that's the region that I like to adjust in kiddos that are having constipation issues, because if you think of it anatomically, you know, you have your spinal column in the back, and coming out are those nerves. Sitting out right in front of the organ, or from the vertebrae, are those organs. So your rectum, your colon, digestive tract. So those nerves are telling the digestive tract, hey, you need to process these nutrients, you need to break them down and, you know, turn them into bowel movements. So if those vertebrae have tipped or shifted or anything like that, they're then blocking the nerves that are trying to communicate to the organs sitting in front of them. So we're trained as chiropractors to shift those vertebrae to be straight, so those nerves can then optimally communicate to the organs sitting in front of them. So kiddos with constipation issues, that's why I go back to the lumbar region and really allow those vertebrae to become straightened so those nerves can communicate optimally. So it's been pretty amazing for the constipation stuff. There's a lot of testimonies on our website that or our Facebook page that have really shown how quickly kiddos respond well to chiropractic care and constipation. And you're really going to the root cause then, that you're aligning the structure where it should be so the nerve can communicate to the organ. Then the baby doesn't have to be on Miralax or other supplementation. You're really going to the root cause and then fixing that instead of just covering up symptoms. So that's a really interesting way. And a lot of people don't know chiropractors can help with these visceral organ issues that we like to call them. They just think of us as backcrackers. So that's part of our accountability too, that we have to sit and educate people because they don't know about these issues. So that's a huge passion of mine, is education, so we can really help people find the root cause instead of covering up symptoms. So,
well, you are educating us today, and we appreciate it. At the younger age, what is the sort of the biggest precursor to seeing these vertebrae that are sort of tilted one way or the other? What are kids doing that get them to that stage?
So they can just kind of be uncomfortable. Like, what are you asking? What are the kiddos doing that are causing the vertebrae to shift and tilt?
Yeah.
A couple different things. It could be even starting in utero. Maybe the baby wanted to lay a certain way and is feeling comfortable more on mom's right side or left side. So it's kind of that position for 9 months in utero that could be allowing those muscles to be kind of contracted and used to that muscle memory position. It could be delivery, whether it's a vaginal or C-section. That's going to be a lot of pounds of pressure coming out of the vaginal canal or C-section. And so the midwife or OBGYN is obviously going to pull on that cervical spine, and that can be upwards of 60 to 90 pounds of pressure on their little necks. And that's nothing wrong with that, but it obviously shows us that muscles are being pulled, vertebrae are being shifted out of position, and all of that is natural. But that's when we come in and really help give those kiddos the optimal, effective chiropractic care. So you were asking about breastfeeding. I sometimes even go up to hospitals and adjust babies right after they were born if the mom is having some latching issues, or if there's some breastfeeding issues. Maybe baby has torticollis where the neck has just kind of been tilted in that position for a while and they don't want to turn in a certain direction. So we're able to, really work on some soft tissue muscle relaxation, but then we're also able to just use my pinkies that I'm able to adjust their vertebrae too. And then that allows the head tilt to go back to normal, and then they can latch on either side for mom and stuff. So there's such an emotional component to that too, for moms who want to breastfeed but they can't, or baby only wants to latch on maybe right side or left side because of their head tilt or that torticollis that is kind of impairing that natural physiological response to happen. So it's pretty neat to help moms and babies, flourish at that point. So it's pretty cool.
So you sort of answered it, but there's really no too soon to have this care and this proactive kind of action on your newborn, on your child, right?
Correct. Yeah, I adjust pregnant moms all the way from preconception to during their pregnancy, all the way up to I've had adjustments hours before they've even gone into labor. Sometimes chiropractic care can even induce labor because you're allowing all the hormones, relaxin, etc., to really optimally function as it should. So you're just really setting the mom up for success during labor, aligning their pelvis as straight as they can. And then once baby's out, like I said, I've been called up to hospitals, moments after baby's born, and that's been such an amazing experience. So it's not really necessarily what baby is or is not doing. It's just really looking at their daily activities of living. So the ADLs that we call them, activities of daily living. So what is their ADLs? For babies, you can't really think of that. They lay on their back and they cry and poop, right? So there's not too much they're up to, but it's still, what way is mom holding the baby? What way is mom feeding, left or right side? Otherwise bottle fed. So it's just different positions, just like we are. You know what I mean? So you really have to break down their muscle movements and their activities that they're doing throughout the day to really look at the muscle imbalances, how is that pulling on the vertebrae, those types of things. So it's really fun to look at each case individually too.
I have this image right now of like adjusting a child kind of like scares me. Like if I don't have any kids, but my newborn comes out and I say, hey, Dr. Weister, my kid's been laying for 9 months like this. He needs his neck readjusted. What does that look like? Are you doing because I've had my neck adjusted and it's like a quick movement. Is it the same exact thing for a baby? Like, what does that look like?
Gosh, that's a good question. You know, I have so many new patients that come to me and they pull up this YouTube video like, do you crack necks like this? I'm like, no, not at all. You know, we're really trained health professionals to learn how to adjust the cervical vertebrae. So it looks so much different in adults versus children. Even as myself, as a female chiropractor, I don't have like that strength, or, you know, I don't have the man hands of, you know, how men usually adjust. They're much more forceful sometimes than women are. And not everyone, some are, but just being female, I've also adapted to my patients. So we kind of have a big toolbox of different adjustments that we can use on each person. In reference to babies, though, I'm honestly using my pinkies to adjust their necks. They're laying face down, and I'm just kind of coming on either side because their necks are still cartilaginous, meaning it's kind of like the material that makes up your ears and nose. Their bones aren't fully formed yet, so it takes almost 2 years for all, you know, like they check the soft spots of the skull and the cranium. Their vertebrae in their back too is still not fully formed as bones, so you don't need the pressure that we would utilize in an adult patient. You just need that light pressure. So I always like to reference as, for patients that are parents that are concerned, it's like checking the ripeness of a tomato. It's very, very light pressure, but that's all you honestly need for babies of that size and of that age. So it's very instrumental and it's very effective, but it's nothing like adjusting adult patients. So I like to how do I say this? I like to offer parents that confidence that I'm definitely not going to be adjusting them harshly or anything like that. I have an 18-month-old myself, and I have been adjusting her almost every day since she was born. And so it's really neat to see kiddos that grow up with it too, because they love coming to the chiropractor. Then they feel good. They can even communicate with their parents. Then, oh, you know, my back really hurts, Mama. I want to go see. I get called Dr. Helicopter a lot because they can't pronounce chiropractor. So I'm known as Dr. Helicopter to a lot of my patients. So it's really cute. So it's just fun to make that experience for the kids too. They love coming to play with toys. They love coming with their family. It's definitely not the same experience as going to a medical office. So we make it comforting. We make it safe. We spend a lot of time with our families. And so it's great to develop those relationships.
It's kind of amazing because you found your passion in chiropractic care, but then diving even deeper into it, you found sort of a niche of, it seems like, well, you're very educated on, you know, younger patients and children and things like that, which is amazing because, I mean, a lot of people don't even think about that.
Yeah.
What got you really passionate about the younger and pregnancy and right after like pregnancy patients?
Yeah. Again, I want to bring it back to Lucy. It was all making those medical decisions for her, and she was having some latching issues when I first had her too. So it was nice to see how quickly she responded to chiropractic care. You have to think too that they don't have the years of degeneration, you know, like we do. So it's amazing to see how quick their bodies adapt to the chiropractic care because it's so quick and they don't have the years of blockage that we often do of the trauma and the exercise and the toxins of nutrients and stuff. So they're just amazing how quickly they respond. So I would definitely say being pregnant myself and then having Lucy, I think it also adds a little credibility to my practice too. I think that helps. I can really relate to my pregnant moms. Obviously, not all the same symptoms. I had a very easy pregnancy, but it was very instrumental of how quickly my labor was and how pain-free it was too, because I was having consistent chiropractic care throughout my own pregnancy and then for Lucy as well. Her health has been pretty much exceptional. She's had a couple little flu instances, but nothing compared to a lot of kiddos that I see, which is unfortunate. And that's why I think why I'm so educated is if we have healthy families, that affects so many other aspects of people's lives. You know, their finances, not having to skip work, you know, their emotional stance of knowing that their kids are healthy and well. I mean, it really goes into so many different aspects of people's lives when their health is at the forefront. So it's cool to see that too.
What do you feed Lucy? Are you like all whole natural foods? What makes a healthy kid? Is it just chiropractic or I'm kind of asking a rhetorical question here as I said, what do you feed her? But I mean, what are you doing to have a healthy baby, a baby that's not, getting the flu, that is thriving?
Yeah, great questions. By no means am I perfect. I'm still working on so many things myself, and it is all about balance. Am I going to lie and say that she hasn't had a Culver's McChicken or Culver's chicken, whatever? I can't even say it now because we don't go that often, but obviously she has, and it's all about balance. You know what I mean? I would say 90% of the time, are we getting whole foods, organic? Absolutely. 10% of the time, are we going to go get a Culver's ice cream or, treat her? Of course, she's had Reese's peanut butter cups before. I'm not going to lie and pretend we're perfect, but I think that's what life is all about. Obviously, I'm going to 90% of the time really try to fuel our body with as optimal nutrients as we can, but I'm also not going to be a crazy mom who, Grandma, you can't feed her Reese's Puffs. You know what I mean? Like, it's okay once in a while, but 90% of the time, like I said, we're really trying to feed her the whole organic foods and stuff. And she's in the toddler years of really experimenting with food, but she's also been exposed to so many different foods. So I think her palate is really wide, which is great because so many moms struggle with, my kiddo only wants to eat SpaghettiOs and chicken nuggets. And I think that's also part of our culture. Like, it's okay to give your kiddo kale and spinach. I mean, they don't know any different, that it could taste gross. You know what I mean? So it is fun just to experiment with Lucy, and she just gets whatever we're also eating. And so it's been amazing on a nutrient level of that. I'm also a big fan of supplementation, and not like that's at the forefront. Obviously, we want to cover our whole foods, plant-based diet first, but supplementing just because our soil isn't as good as it once was. The nutrients are depleted as they once were, back in the 1950s. So there just is that monocultural crop depletion that we're experiencing. So it is nice to do whole foods, plant-based diet, supplementation, chiropractic care. Chiropractic care is just a piece of the pie. It's by no means the entire pie. So it's nice to fill, it in with good nutrition, good sleep, good chiropractic care, even doing some infant massages and stuff. I know that sounds weird, but just helping a lot of her body work and stuff. So it's all about mind, body, spirit. You got to fill each avenue and fill that fully. So that's kind of what we've been up to at our home.
Well, getting chiropractic care almost daily and eating holistic foods, that makes for a very healthy Lucy.
Yeah.
That's great.
Thank you.
Phenomenal. You got me really interested when you mentioned how kind of as we progress, we get a buildup of toxins and our bodies might not be utilizing nutrients quite as well because of different adjustments we might need or muscle tension and things. Could you talk about, I guess this is pretty broad, but could you dive into a little bit about the benefits of getting those areas sort of released, I guess, from my understanding, and then helping develop those nutrients a little better in our body?
Yeah, absolutely. I kind of like to use the analogy, especially when I have new patients, that they've never seen a chiropractor before and they're 40 years old. And I say this in a very non-shaming way, but I like to use the example of, like, imagine if you had never gone to the dentist before, and imagine what the plaque buildup on your teeth would be, flossing, how the gingivitis would be in your mouth and everything like that. I think if our spines were on our face, we would take a lot better care of our spine, but that's unfortunate too, and we have to educate better. But besides that, receiving chiropractic care, without 40 years of ever receiving it, there's just that degeneration that happens. You kind of have to also think of it as your car. If one axle is higher or the frame is off, imagine what that's going to wear and tear on your tires. I like to use these analogies because people can at least understand them a little bit better. So if your pelvis is off, imagine what that's going to be doing to your knee and hip joints or your ankle joints. Or if you've got vertebrae that are shifted in your mid-back, imagine what that could be doing for how many years when it's been misplaced. So the degeneration or the breakdown of bones in that area is really crucial to try to avoid that and prevent that. So I really like to inform my patients that it is super important to at least start where you're at so we can at least stop the progression of arthritis or degeneration. Sometimes we can either even heal that and almost regress. It kind of just depends on where the patient's at. going back to your topic of like nutrition and toxins, though, we're taught in school that there's 3 T's that you really want to look for. So it's toxins, trauma, and thoughts. So thoughts is kind of your mental awareness. Are you having a really stressful environment, whether it's at work or your personal life? How can we relieve that thought kind of trauma to make sure that that's as low as we can? So we want to address the mental aspect. The toxins are going to be anything you're ingesting in your body. Are you having filtered water? Are you having supplementation? Are you eating whole food, plant-based diet? How are you fueling your body to have the best nutrients and giving your body the best optimal chance to thrive and perform as you want it to? And then for the trauma aspect, that's really could be a couple things. It could be exercise is technically a trauma. It's micro tears of your muscles as it's growing, but it's a good trauma. There can be good or bad. Bad would be you just got in a car accident and that's whiplash. Your head was just whipped in different directions and your ligaments are unstable now in your neck. So there's multiple different things that go into trauma, whether good or bad. But collectively of those 3 T's, the trauma, the toxins, and the thoughts, we really want to combat that as a wellness program for our patients. So that's why we like to ask, how is your stress level at home? How are you doing at work? What kind of food are you fueling your body with? Has there been any change in your physical performance? Are you training for an Ironman? Are you more a couch potato? How can we help you just thrive in your body as optimally as we can and help them navigate those choices and meeting them where they're at? There's absolutely no shaming, especially if people don't know, there's so much that people don't know, and how are you supposed to make informed decisions on education that you don't know? So that's, I think, a huge value and a mission of us at 920 is implementing all these different aspects so we can help you on your wellness journey wherever that may be. So I hope that answered your question. It was kind of roundabout.
You answered it and then some. Thank you.
Yeah.
Could you explain to everybody sort of what you all have here for opportunity at your studio?
Yeah, it's definitely grown. Last year in August of 2018, that's when we first opened. So we've been open about 13 months now, which is exciting. So at that time, it was just myself. So I do chiropractic care and I'm working on my functional medicine diplomate. So that's just a lot of that testing and nutritional side of piece for patients, which is going to be really interesting. And then I have a health coach and then a massage therapist. So us 3 started and now we're up to 10 of us. So I'll kind of just list them off, but we have a mental health therapist now, we have a yoga instructor, we have somebody who does more self-care, so she does like lash, brow, lift and tint, she does facials as well. We have another massage therapist, trying to think who I'm all missing. We have an acupuncturist that's going to start with us. We have a midwife and a lactation consultant. And we also have somebody who possibly might be joining us for Reiki too. So we've got a couple people that are in the loop of seeing who's going to come with us, but we're really trying to fill that niche of multiple pieces of the pie and having that one-stop shop for, your mental care, your body work, your nutrition. We really want to fulfill different niches there. So that's the vision of us at 920.
I think the best part of that is, especially since you focus on a younger demographic and pregnant moms, your business is covering many aspects and you're starting your patients extremely early. So that's phenomenal. I think that's what sets you apart from any other industry or anyone in the industry. So
thank you.
That's awesome.
Yeah, thank you so much.
What if we could get you like in the mall food court and replace every food court place with everything in here? I don't know why I thought of that, but that would be awesome.
Yeah, wouldn't that be so neat?
So we talked off the air kind of about the vision, and that's kind of the vision, not in the mall food court, but you want to go big, correct?
Correct, I do. I do the vision boards. I think every entrepreneur really should, of where they want to go 5, 10 year, 20 year. I definitely see 920 expanding, and I do foresee it having multiple locations one day. It would just be such a dream of mine to help people and really educate them and empower them to take accountability of their holistic health actions, empowering them to want to feel good on a day-to-day basis and giving them the education to do so. So I really foresee that as a 920, not only helping them with their body work and scheduling appointments for their mental health, but also educational piece is going to be a huge vision for us too. So multiple locations one day, and I really see us having a full strip of businesses all in one location, which would be really neat for the mom who wants to come and get her hair done, maybe even her nails done one day. It's going to be that combination of a spa-like salon, but then also the body work composition of it for doing chiropractic care, massage, acupuncture. So it's all about that mental wellness, physical wellness, spiritual wellness. So we kind of want that to be your one-stop hub for that. So
that sounds great. I mean, to the people that are interested in starting their own business, and to those that have, is there any specific just pieces of information that you took from a mentor or something, or a quote or something that really sticks with you, that has helped you over the past year, and then you're starting up to that to get to where you are today?
Oh gosh, that's such a good question and so difficult to pinpoint that. I personally have not worked with a specific mentor. I've gone to a lot of like group consultation type stuff, or listening to podcasts and those types of things. As an entrepreneur, I really find this as a personal journey for myself. So it's not even only an entrepreneurial growth, but also there's so much personal growth that comes with this. If my brand isn't welly liked, or if it's rejected, well, I feel that in my heart as like, why don't they like me as a person? And so there's so much personal growth that goes into it. I wouldn't say this is necessarily a quote, but something that I've been trying to implement into my daily practice when I'm feeling overwhelmed, or when I'm learning new struggles of entrepreneurship. I'm trying to switch my mindset and my vocabulary to, I have to do this task versus I get to do this task. I have this beautiful space, but I get to wash the windows, or I get to meet with my staff. So it's more of that personal growth, I guess, that I'm working on. And there's been multiple influences of like Tony Robbins. I'm going to church and doing character development there. There's been a lot of influences that it's hard for me to pinpoint, but just that little phrase of I have to versus I get to has been very instrumental just for me and my mindset of an entrepreneur this past year. So that's been helpful.
Always being grateful what you have. It's great.
Yeah.
And then never stopping to, seek out growth. So is there anything else that you'd like to share with the listeners, and where they can kind of seek you out and watch your business continue to grow?
Yeah, I just want to thank you guys, Chad and Zach, for having me in this opportunity. I know I was really nervous in the beginning, but it's been great chatting with you guys as well. Yes, feel free to follow us on Facebook, 920 Wellness Studio. You have to pronounce it with that Wisconsin accent, right? But it is just 920 Wellness Studio when you're typing it in. So feel free to follow us on social media. That's where we're posting a lot of our great inspirational quotes, or our educational pieces, or our specials going on, and what's been new at 920 Wellness Studio. Otherwise, our website is www.920wellnessstudio.com. So social media, our website is a great place to follow us and stuff. We also have online booking in case anyone does want to go ahead and book an appointment.
It's funny you actually mentioned that, because I guess I never even really thought someone driving by would be 920 Studio, but us being where we live, we just automatically say 920.
Yes.
That's funny. But please come by if you're interested. They have a very welcoming and beautiful office. It's very unique, and come check them out. So thank you, Dr. Mikhaila, for joining us today. We appreciate your insight and education. And for the listeners, please give us a like and a review, and definitely come check out the great things that they're doing here at the 920 Wellness Studio.